Hey, Section 6. Good job on talking about carpal tunnel this week. This is the last week you're going to be in these groups. I will post the updated groups in with this wrap-up. So this week we talked about carpal tunnel syndrome and upper extremity peripheral nerve disorders. And we had some really great material to go over. So as far as just kudos, pat on the back, Aaron, Julie, and Sanjan, you guys did a great job this week, above and beyond. Good job on getting some additional literature into your original posts, and then really, getting in the discussion and getting the most out of the course by putting more into it. So, great job. So we talked about some, just from the required readings this week, that we probably should be doing some neural mobilizations. We had some discussion about different terminology on that, but we should probably also be doing some carpal mobilizations. And then some other things we talked about, starting from a little bit more broad viewpoint, and this is from Goodman, 2010, this article, looking at this table on the causes of carpal tunnel. And then looking over on the right on all the things that are typically out of our wheelhouse, but that we should probably keep on our radar that could be causing some carpal tunnel. So good to keep in mind and kind of keep the bigger picture in there somewhere. There's also possibly some central sensitization in some of these folks, especially with bilateral carpal tunnel. So need to keep that in mind. They all many of them will also present with some poor posture, restricted cervical range of motion, and we haven't gone to the next step of this and seeing how much improvement we can get if we incorporate this into our impairment-based treatment program, but it's certainly a start. We also have some evidence on the evidence is a little bit conflicting on whether or not we should be using splinting, but there hasn't been really great studies looked at it. This one looked at night splinting and carpal mobilization and found good benefit with that. And then the article that we snuck in here in your required readings but didn't ask any stimulus questions on was De Las Peñas from this year, looking at surgery versus physical therapy, and found that there were similar changes in pain and function in each group. Many of the other articles and systematic reviews that we saw kind of give the nod to surgery, and it certainly is one of the easier surgeries that we will talk about. But here's some evidence that there may be no difference in that. So this next week we will be looking at, you're going to have your new groups, and we'll be looking at regional interdependence. We've kind of been looking at this throughout, but we'll have some devoted time to look at that. So thank you guys, and I'll see you on the boards.